I'm just absolutely honored to have Dr. Lisa Patel present next. She's a clinical associate professor of pediatrics here at Stanford. She is also the executive director of the Medical Society Consortium on Climate and Health and co-founded the Climate and Health Task Force for the American Academy of Pediatrics California chapter, and also sits on the executive committee for the AAP's National Council on Environmental Health. It is an absolute pleasure to have you, Dr. Patel. Thank you so much.
Thanks for having me. And I think what I'm hoping to do is to summarize, I think a lot of great points that were made today. I'm going to offer a potpourri of various solutions. And the place I'm speaking from is sitting, I think, in the seat of a lot of you. Years ago, I too was wondering what difference could I make? And I'm hoping to share a little bit about my journey. But first, I do want to acknowledge that it is Juneteenth. And this was a poem that Dr. Mustafa Santiago Ali, who's at National Wildlife Federation, wrote. In the land of Juneteenth, where freedom sings, we rise to conquer the toxic things. No more shall we breathe polluted air. No longer shall we drink waters unfair. We break the chains of poisoned land in search of a world both just and grand. The climate crisis, a battle we face with fierce resolve, we claim our space. For freedom's flame ignites our soul, and we fight to make the broken whole. With every step, our voices unite in a symphony of justice shining bright. Oh, let the chains of fossil fuel fall as we march together, one and all. In Juneteenth's embrace, we find release and envision a future filled with peace. So let us rise in unity's fight to break the chains and make things right. In Juneteenth's legacy, we shall prevail for freedom's quest. We will not fail. And so before I became a pediatrician, I was actually an environmental scientist, and I worked across a range of issues. And my path into working on air pollution and wildfires, really one of my moments of awakening was in 2020. California had one of its worst wildfire seasons. I'm a community hospitalist, so I care for premature infants, well newborns, and hospitalized children. I do a little bit of everything. And that day, the smoke outside was so overwhelming, my NICU reeked of smoke. So we had tiny premature infants there breathing in that foul pollution, as we've heard, is several times more toxic than regular air pollution. And we were able to get some air purifiers in to make the air a little bit better for those kids that day. And it made me feel better. It made me feel like, maybe there was something I could do to make the climate crisis better as a clinician. Well, fast forward to the next year, this was also middle of the pandemic. I have two children, and this was a picture of the two of them when we went into lockdown that weekend. My daughter started kindergarten on Zoom. I had spent that year working with schools around how to get the air quality indoors to a good place in terms of ventilation. I'm thinking about the pandemic. But realizing that we were going to run into some problems when school started again, because in San Francisco Unified, where my daughter goes to school, there are no HVAC systems. They never needed one before. So they were planning on mitigating the pandemic by keeping the windows open. And sure enough, what I predicted happened is exactly what happened. The wildfires hit. They had no plan in place. I got a call from one of the folks in public health there saying, well, which one's worse? Is it okay if they sit outside in an AQI of 150 and eat lunch out there, or risk getting, COVID indoors? And I thought, this is crazy. This is not the world as it should be. And just feeling powerless as a parent, even though I work in the climate crisis, I felt like I've been able to keep my patients, my babies safe the year before, but now I was sending my baby directly into harm's way. This 2 weeks ago, when the East Coast suffered those really terrible air pollution days, I think I did 20 interviews in just a week from various news sources, with that sense of awakening that I think a lot of us felt when the sky turned orange. And it made me think of, and I think when we were all going through it in California, I kind of felt like, when we were like, oh my God, the sky is orange. God, why are everybody not scared? And I felt crazy. And it felt a little bit like the whole country is going through an awakening at the same time. And no longer is anybody calling anybody else an alarmist anymore. I'll be interested to see the data on public opinion in the year to come, given what we've been through this year and the years ahead as this crisis gets worse. So I really enjoyed Dr. Lee's talk as we're and seeing everybody's words about the negativity, but I do, again, much like Dr. Lee framed, I want us to frame this in what the possibilities and the opportunities are for the world that we can build. So where, we think about climate change, it's unsightly, polluted, isolating, harmful, inequitable. We see all those terrible news stories, but this is really our opportunity to create a world that is beautiful, clean, connected, healthy, and just. That's what these climate solutions give us and offer us the opportunity to do. I put this slide up just as what we should not do, and I really appreciated Dr. Carmichael's talk because I see very often us citing statistics about disparities without talking about the structural reasons behind them. And so statistics like a Black child being 4 times as likely to die from an asthma compared to a white child, we throw those statistics up, but what's behind that? And we've heard that, but to put this whole narrative together, drawing from Dr. Pacheco's talk, we have fetuses that are exposed to that pollution before they've even taken their first breath. And this is because we more often have polluting facilities sited in communities of color and communities that are experiencing poverty. And then those infants, those children grow up in these polluted environments and are more likely to develop asthma. We have places like West Oakland, which is a higher percentage Black population that has a freeway encircled around it. And so those children who live within that beltway are several times more likely to have asthma than the white children that live in the Oakland Hills just a little bit farther away. So they're exposed to it earlier on. I think there was some discussion about access to medications. A Black family is less likely to be able to afford their asthma medications. And then once they arrive at a healthcare facility, there's implicit bias where a Black versus a white child will receive differential care. And that is how we have these completely unjust outcomes of a Black child being 4 times as likely to die to asthma compared to a white child. We see evidence of this kind of environmental racism throughout the Bay, throughout Northern California, whether we're talking about the Chevron refinery in Richmond, I've talked about the situation in West Oakland or Stockton, which is one of the most racially diverse cities in California and some of the most polluted air in the entire country, despite the fact that California is fairly progressive in terms of its fossil fuel regulations. So I really like this quote by Hop Hopkins, the Sierra Club. You can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people, and you can't have disposable people without racism. So how do we take all this together and solve the climate crisis? First and foremost, we must remove the social license of the fossil fuel industry to pollute. We've talked a lot today about air pollution, but we really need to paint this problem where it is. And it lies with the fact that fossil fuel companies have been given free rein to pollute to this point, and now we need to remove their social license to do so. We need to ground our messages on climate change around health to win broad bipartisan support. And finally, we need to enact policies to facilitate that transition off fossil fuels. So first, remove the social license of fossil fuel companies to pollute. We have known as far back as the 1960s that fossil fuel pollution was going to be a problem. This was actually a report that was put together by the American Advancement of American Science, predicting what carbon dioxide, pumping all that carbon dioxide was going to do to the globe. This is a cartoonist that I really like, and he has a lot more cartoons beyond this, but I just want to give this little fragment or piece of it, which is back in 1959, the American oil industry invited a physicist, Edward Teller, to come talk to them about their company and their operations and the impact it was going to have. Carbon dioxide in the atmosphere causes greenhouse effect, and burning more fossil fuels could melt the ice cap and submerge New York. True fact, because that's what all of our modeling shows today. There's been some recent evidence that shows that Exxon knew with remarkable accuracy 50 years ago what the amount of carbon dioxide we were pumping into the atmosphere was going to do. Now, what did they do with all this information? Were they responsible corporations that let the public know what their operations were going to do? Absolutely not. What they've done, if you look at the amount of dollars that they have spent on public misinformation campaigns, on buying out politicians' votes, even after we've long had the technologies to transition off fossil fuels onto renewable energies, they've consistently funded campaigns to confuse the public, make it think that it's our fault, and create the structures that perpetuate our dependence on fossil fuels and perpetuate environmental injustice. And so this is just a quote from a sting operation from Greenpeace on one of the lobbyists that says, did we aggressively fight against some of the science? Yes. Did we join some of the shadow groups to work against some of the early efforts? Yes. But there's nothing illegal about that. You know, we're looking out for investments. We are looking out for our shareholders. So we are at a school currently that freely takes fossil fuel dollars. Unfortunately, one of the first initiatives that has been promoted by the New Door School of Sustainability both advances a project that the fossil fuel industry thinks that is a solution called carbon capture and storage that is opposed both by health groups and environmental justice groups. So there's a lot of work that we need to do as academics and inject our health voice and inject the environmental justice voice to make sure that we are grounding our solutions in health and equity and remove the social license of fossil fuel industry to operate, much like what we did with big tobacco. So, thank you. So, as we also know, and we've heard all this data time and again. So I'll say one more time: fossil fuel pollution drives 1 in 5 premature deaths per year globally. So we all understand what tobacco has done, and I want all of us to think about fossil fuel companies the same way. Now, the difference between tobacco and fossil fuels, I will say, tobacco is something nobody ever needed, right? It was an addiction that was perpetuated. Fossil fuels definitely had a use in time. So I'm not saying that they've been bad throughout, but what their behavior has shown over the last 50 years, they had their use, they had their time. We have different solutions now, and they have stopped it. They have obfuscated it. And that is where I hold them accountable and guilty. And so now we need to switch over to the technologies we know are better for our health. So second, we need to ground our messages on health to build more broad bipartisan support for solutions. This is research. So I'll tell you a little bit about the work I do at the consortium for the Medical Society Consortium on Climate and Health. I'm embedded within a center that does climate communications research that's led by Dr. Ed Maibach. He's been doing this research for 10 years that basically shows, divides America into how many people are alarmed versus how many people are dismissive. And what's very interesting about the data is look at that alarmed segment in particular. We have gone from 12% of people who are alarmed up to 26% as of 2022. And I think it's because as the health impacts of climate change and as these climate disasters grow worse, we can no longer ignore them. So we can expect that these numbers are only going to grow with time. This is more survey work that he's done, and back to I think the example that Dr. Lee was giving, and the work that Andrew Lewandowski has done as well. What this was looking at is, we live in this ecosystem of way too much information and lots of misinformation. So when we deliver information, who does the public want to listen to, and who do they trust? And so very interestingly, if you look at Republicans and conservative Republicans, they really trust their primary care doctors. And so you can take a script like Andrew Lewandowski's and deliver that script, and you can actually change minds of a political party that is more likely to disbelieve climate change or not want to engage on climate change. I know, it's interesting, right? There's also been conversation about, well, what are the effective messaging? So I'm the executive director for the Medical Society Consortium on Climate and Health. It was built really on Ed Maibach's research that showed that the health message is the most resonant and health messengers are the most resonant messengers. What we do is we actually bring together all the major medical societies. We are now up to 50 medical societies, including organizations like the AMA, the AAP. We now represent 700,000 physicians around the country. And we have built the messaging tools, the messaging guidelines for you to deliver, whether you're talking to your colleagues, whether you're talking to your patients, whether you're talking to your hospital CEOs. And what we know is that reading brief statements about the 8 health harming pathways of climate change and who is most likely to be harmed increases people's cognitive and effective engagement with the issue, especially with moderates and moderate conservatives. The effective messages show the health impacts. The top 3 are air pollution, foodborne disease, and extreme weather. And I'll tell you the most resonant thing to talk about is how it harms babies' brains. Those numbers are astronomical. 2, identify policy solutions. And so to take it away from the frame of talking too much about the problems, but really focusing on what the solutions are and the brighter, healthier, happier, connected future that we can enjoy. And then affirm helpful social norms. So most Americans agree that we want healthy communities and a healthy climate, but not enough of us are taking action. Okay, so we've talked a little bit about the message, and now finally to the policies that we need to transition us off fossil fuels into renewable forms of energy. So at the consortium, this is our theory of change. We work with policymakers, with the public, and we also engage our medical societies, starting from a place of education to make sure that the educational tools are there. But medical societies are also engaged with decision makers. When organizations like the American Medical Association, the American Academy of Pediatrics speaks on climate change, it's actually very, decision makers really sit up and listen to what is said. And so what we really do is engage all of these various medical societies to engage on climate change and on climate policy. Climate change is a systemic problem that needs a systemic solution. And you will hear me say this again and again, because one of the things that fossil fuel companies have been very good about doing is making you think, for example, that if you enjoy red meat, you're not allowed to talk about climate change. If you drive a gas-powered car, you're not allowed to talk about climate change. When we have created systems that make it impossible for you to live a fossil-free existence, I give you full license, drive your gas-powered cars, and advocate for climate policy solutions, because structural change, systemic change is what we need. Not to say you should also try to get off your gas powered cars if you can, but, but not to say that doesn't make the crisis your fault. If you want to learn more, we pediatricians are awesome. We're rock stars. We are one of the first societies to get both maintenance of certification 2 and now 4 opportunities to learn more about climate change. The 2 opportunity is just question and answer. You read some articles and it's 20 questions. The 4 has just come out. It is actually Andrew Lewandowski and a few of our other colleagues created more scripts beyond just that one on a variety of scenarios that you can use in your patient encounters and its quality improvement. So you do a before and after, and then you actually use those scripts to do an after to see how your practice has changed. We at the consortium, engaging in policy is really, really complicated and really, really overwhelming. And we recognize that. It's not an easy thing to say, I'm going to go in and I'm going to advocate for clean energy policy. So we invite you into the consortium, and I'll have a QR code at the end to start learning what those skills are. Some of the work we're doing through the Inflation Reduction Act is helping community health centers access the Inflation Reduction Act dollars to improve their community climate resilience. We're working in partnership with the National Association of Community Health Centers. So if you work at a community health center, we're building all the toolkits and resources. We're also creating patient resources that you can have in your clinic. So patients know that they essentially have a $14,000 tax credit from the federal government to improve the health and the climate resilience of their homes. Also, Dr. Lee had mentioned the pledge to decarbonize. Our state advocates actually helped to relaunch that pledge because it had initially been closed, because it has been such a powerful organizing tool. We at Stanford actually have a group of really well-organized students and faculty that when this pledge came out, we organized a letter, got 90 signatures that we were able to send to our CEO. And we're really proud that Stanford Healthcare has signed that pledge. For anybody listening online, or if you've come from another institution, you can visit our website and see we have templates built to engage your CEOs in this conversation. If you want to work more locally, I've done a lot of work around climate resilient schools in California. And again, I'm just giving you options to get involved. It really just depends on where your energy is and what you're passionate about. And we built a very large coalition to ask the state to better prepare our schools. Our schools in California are not built to deal with either the wildfires or the heat or the mental health crisis that's going to be made worse by climate change. And what this report asks our state leaders to do is to create a plan to address all of this. It's a coalition where we ask anybody to join in because we have a long legislative campaign ahead of us, and as many voices as we can get involved, and particularly health voices, is very powerful. What was really exciting about this work, and back to the point that I was making earlier, the research that we have on indoor air pollution is not new, but what was new, that we did with this report, we put health and equity up front and center, and that turned out to be very powerful. In a year where we have a deficit in California's budget, where they're slashing things left and right, we were asking for $10 million more. and it sailed through the Senate with a 44-0 vote. Because who's going to say that we shouldn't be doing the basic things to support our children's health and well-being? So the health message matters, and we as health professionals, as messengers, really matter a lot to the success of policy. If you want to take a quick action today, your climate action for the year, this is one of the most important things that you can do. The Environmental Protection Agency has released a rule to basically regulate the fossil fuel emissions that are coming out of power plants. We have a form letter written. All you need to do is just put in a few sentences in front of that letter and send it off. We are hoping to have 750,000 comments across our entire climate coalition, 2,500 coming from health professionals. And we need that because the fossil fuel industry is going to fight this rule tooth and nail. And so we need as many people as possible to really be the counterweight to their power. And my time is almost up, but a few other places of solutions that I want to offer. If you're not familiar with Vote ER, voting is a social determinant of health across all the structures that affect our patients. 2024 is a critical year. This is a nonpartisan, non-political way to get your patients, particularly the ones that are more likely to have less access to be registered to vote and more likely to be affected by these structures that determine a poor health for them. It's a badge that you carry around. You ask them if they're registered, you have them get registered. You do not talk to them about politics or who you're voting for. And I encourage every one of you to sign up for one of these badges. This is important, I think, in terms of climate change, but bonus if next year, thinking about showing up to town halls where there's going to be debate amongst people who are voting for re-election and really pressing your leaders to be a part of the solution. And then I'll just leave this one finally, is to join a group. Going at this alone, it is not sustainable. This is hard work. So whether it's, within Stanford, we have a group called Stanford Climate and Health. Outside of Stanford, there's Climate Health Now and Physicians for Social Responsibility. And then the organization I lead with this, which is the Medical Society Consortium. It will teach you the skills to take your research or take your education and ensure that it gets a broader audience. So I'll just skip to the end here. This is just a training we're offering. If you go to our website, you'll learn more about it. But the problem is big, but so is the opportunity for change. And please consider joining our community and being part of the solution.